Hi everyone, we are so grateful to have you again in this video. We are going to share something about spectacle use, why we have refractive errors. What comes to us, why we need glasses is that it is because of different proportionalities, sizes in terms of body structures, the structures of the eye. We have, for example, we have short-sightedness, we have long-sightedness, we have presbyopia, astigmatism. All these refractive errors come because of different proportionalities in the shape of different structures of the eye. For example, the first structure that influences our refractive nature is the cornea. Some people, depending on how the shape of the cornea is, it can bring in different powers for us to bring the light into focus on the retina. There are some people whose corneas are cone-shaped. There are those ones whose corneas are flat. There are those ones whose corneas are in the normal shape. To all those people who don't need glasses, the cornea is in the normal shape, dome-shaped. But there are others whose corneas are very sharp in a condition called keratoconus and many other conditions. So this cornea also determines the refractive power that you are going to have. Then also the distance between the cornea and the retina. When the distance is short, you're most likely going to have what you call long-sightedness. If the distance between the cornea, it is called the axial length, the distance between the cornea to the retina, when it is very long, you're most likely going to have short-sightedness. The distance also matters. The first thing you have said, the cornea. The second thing is the distance between the cornea and the retina. Then the third thing also, it depends on the lens, the refractive nature of the lens. So when the lens, the refractive index of the lens also matters. It can decide whether you become short-sighted, you be long-sighted, or you be astigmatic. So in this case, what you're trying to derive to is that having specs does not do with age, but it does with the variation of these structures. Only the glasses that is determined by age are called presbyopic glasses, the glasses for presbyopia, where when you're reading, you need the specs for that you can read. But other specs for short-sighted, long-sighted, astigmatism, and all other of the sort depends on those seriously 3 points: the nature of the cornea, the axial distance, and the refractive index of the lens. Then come because of the retinal pathologies. For example, if a person has glaucoma, a person has diabetes, and the other systemic diseases, these are having those ones, they have other underlying systemic problems. That's when they come in. And even when we are to give out glasses, we first check out to rule out, do you have glaucoma? Do you have diabetes? Do you have hypertension? All those systemic diseases. So there are those refractive errors that come as long because of those challenges. That's why before you get specs, it is very, very important for you to have a thorough eye examination before you get the specs. So those are the three things that we have talked about that really make us be what we are. We have specs and so on. I intended to tell you about why we always have specs. So it means with that information, these variations can cut across even a child of 80 months, even a child, a neonate, a child also who is still young also needs specs. So if you're a parent, never compromise when the child needs specs. Allow the patient to get the specs. It's very important for vision development and improving vision.